More than 60 years ago, Knoxville was in desperate need of a health facility for children suffering with mental illnesses. At the time, there was little attention being given to this serious issue, but there was one woman who envisioned such a place. Helen Ross McNabb was determined to open a facility in Knoxville, and in 1947, she single-handedly made an appeal to the Knoxville City Council for funds to open a mental health clinic for children. In October 1948, the doors of the very first children's mental health clinic in Tennessee were opened in Knoxville. Each year, the Helen Ross McNabb Center provides services in 19 East Tennessee counties for nearly 11,000 adults, children, and families who have the least resources.
Being a client here at Helen Ross McNabb, my son has been able to communicate with us as parents better. When we first came here, we didn't know even what the center was, what it was about. They sit down and explained what services they offered, the therapies, the medication monitoring, the behavior plans that they could do. When they found the medication that worked right for my son the very first time, that's probably the best moment that we've ever had. He could watch TV, he could play with a toy, he could talk to us without interrupting or without doing all these things. That was probably the most significant thing. We realized that, one, there was a problem, two, we had help for it, and that it would be okay.
We started foster care when we moved to Tennessee. I was 30 years old. I could not conceive children. Our first two children that we got are the two children that are with the center, and they were severely abused. The first time we saw the two boys, it took us about an hour to pull them out from underneath the bench where they were hiding. They were scared. They didn't have a English language. They had beeps, clicks, and grunts. You know, they were just so primitive when we got them. Helen Ross McNabb reached out to us by providing us information, information on the community, resources that we can use. Things that I had no clue existed, they were able to bring to me and to actually put in place and allow us to use it.
The center has continued to change and grow over the decades to meet the needs of the region through a multitude of programs designed specifically for those with the fewest resources and the most debilitating conditions.
I really didn't have a sense of direction. I really felt like I was out on a limb, and I felt like I had no place to turn to, no friends, nobody that would understand, nobody that cared. I was at the point where I was literally going to drive my car over to a bridge, the Henley Street Bridge or the Gay Street Bridge here in Knoxville, and jump off the bridge. When I discovered Helen Ross Center, I really felt like it was a salvation for me.
I had a substance abuse. I like taking prescription medications, pain pills. I was using drugs every day, got into legal trouble, just out of control. When I almost went to jail and was sentenced to a prison term of 10 years, I had a choice between prison or treatment, and I chose treatment. The counselors there, I don't know, they just they just made me understand that it's more to life than that. You know, you can still enjoy life, have fun, and do what you want to do without the use of that.
Today, the Helen Ross McNabb Center has over 400 staff members, from psychiatrists to nurse practitioners to case management workers. With funding from a variety of fundraising efforts, grants, and public monies, the center has grown to become a regional, not-for-profit care provider of mental health and substance abuse treatment.
I started drinking when I was 18 years old, and it progressed, just kept on getting worse and worse and worse. And 35 years old, I tried cocaine. I decided it was time to get help because my health was not good at all. It was deteriorating bad. I went through Centerpoint, a detox, and I was there for 7 days. I feel great about myself. I feel really good. I've gained weight. I feel healthy. I am healthy now.
I believe the depression started first. Really wasn't diagnosed with it. But as time carried on, I began to use my coping skills with substance abuse. I have tried to commit suicide several times, many times. And I think when I went to Centerpoint, I let them know that I needed help, and I needed help bad. And they heard me. I feel so much freer. I am no longer that person I was then.
Treatment is tailored to the needs of the individual by creating an environment that actively values and respects the diversity, talents, strengths, needs, abilities, and preferences of those we serve.
The center itself, Helen Ross McNabb, is one of the best community resources that there are.
They have helped so many people since I have become a member, that the number is endless. The number is endless.
Helen Ross McNabb has never said, if you can't afford it, you can't have it. They've always just went to any lengths and means to say, your child needs this, we can get this for you.
They helped me get my life back.
They have went above and beyond to make sure that my needs are met.
If it wasn't for a place like Helen Ross McNabb, I would be still drinking and using drugs.
The mission here at the Helen Ross McNabb Center has been and will always be to improve the lives of the people we serve.
They're like family. We work as a team, we work together.
It becomes personal. They tend to love all of their children.
Unconditional love. Unconditional love. That's how I feel.